Hi, everyone. Thank you so much for joining us today. For those of you that I haven't met, my name's Drew McCarter, and I'm the president of Pure Earth. And I'm very pleased to welcome you to this webinar co-hosted by our partners, Vital Strategies. Each year, thanks to the leadership of the World Health Organization, we observe the International Lead Poisoning Prevention Week, which is a moment when governments, civil society groups like ours, and the public can come together and raise awareness and commit actions to solve lead exposure and lead poisoning. And for the past 3 years, we have used this moment to share updates on the progress of the Strengthening Health Systems to Reduce Lead Exposure project. This is a project that is supported by Takeda Pharmaceutical Company Limited. And through this project, our teams in Colombia and in Maharashtra, India, in Indonesia, in Kyrgyzstan, and Peru have been working with ministries of health and other partner organizations to build stronger blood lead surveillance and response systems, empowering these countries to better detect lead poisoning, to track it, and to prevent it. I really want to express our sincere gratitude to Takeda for their leadership and commitment in this space, and a special note of thanks to the employees of Takeda who actually voted to award this grant to Pure Earth. As you'll see during our webinar today, each country team is at a slightly different stage of implementation, as these are very complex and ambitious undertakings with a variety of stakeholders. But what I think will become really clear is that each location is making remarkable progress toward our collective goal of reducing childhood lead poisoning. So before we jump in, just a couple of housekeeping notes. Please share your questions in the Q&A box during the presentations, not the chat, but the Q&A box, because we will have a live Q&A at the end of each presentation, not at the end of the webinar, but after each presenter. We will also have teams that are available to respond to questions in the Q&A box directly, so we'll do some written and some live. And with that, let's jump in. We're going to start with a short video to hear directly from health officials in these countries about the progress made over the last year.
Since 2023, Pure Earth and partners have been working with the governments in Colombia, Indonesia, Kyrgyzstan, Maharashtra in India, and Peru to strengthen health system to prevent lead poisoning.
We are designing and implementing programs that identify, monitor, and reduce childhood lead exposure.
This is the third year of a Strengthening Health Systems to Reduce Lead Exposure project, and we're excited to highlight the progress driven by the champions in the Ministries of Health, our partners and stakeholders, and Pure Earth teams. In the past year, there have been major steps forward.
We have tested over 2,800 children for lead in Indonesia, India, and Kyrgyzstan. We have equipped over 110 health professionals and nearly 30 community leaders to recognize, monitor, and respond to lead exposure.
Home-based assessments are helping identify the most common sources of lead in households and communities. And for the first time, countries like Kyrgyzstan now have government-led national data on the scale of childhood lead poisoning.
Dan pada tahun 2024, kick-off event telah dilaksanakan sebagai tanda dimulainya kegiatan lapangan surveillance kadar timbal darah yang sering kita sebut SKTD yang telah dilaksanakan di 12 kabupaten kota yang tersebar di 6 provinsi. Pelaksanaan dimulai dengan prasurvei yang dilakukan di Provinsi Banten pada bulan April tahun ini.
Untuk program SKTD ini kami memulai dengan berbagai rencana dan juga persiapan yang tentunya dikawal oleh Kementerian Kesehatan dan juga Badan Riset Inovasi Nasional beserta Mitra Pembangunan. Dalam hal ini adalah Vital Strategist dan juga Yayasan Peru Indonesia. Kami tentunya melakukan seri rapat koordinasi, kemudian untuk akhirnya mendesain bagaimana program SKTD ini akan berjalan nantinya di lapangan.
Tantangan terbesar adalah membangun kesadaran masyarakat bahwa paparan timbal merupakan masalah serius. Bagi anak-anak, kami membuat materi visual berupa stiker dengan ilustrasi menarik agar pesan kesehatan lebih mudah diterima dan diingat. Kami juga memproduksi video animasi edukasi berdurasi pendek dengan karakter BBC Timbal yang ramah anak, yang menjelaskan bahaya timbal dengan cara sederhana dan menyenangkan.
En Colombia, el avance del programa ha sido posible gracias a una articulación estratégica con autoridades territoriales, organizaciones aliadas y líderes comunitarios comprometidos con la salud pública. Estas alianzas se han convertido en un pilar clave para posicionar el tema en la agenda institucional y promover la sostenibilidad del proyecto. Estamos construyendo de manera colectiva las condiciones necesarias para un impacto real y duradero en la salud y desarrollo de las niñas y niños en los territorios más vulnerables del país.
In Maharashtra, Pure and partners trained nearly 135 qualified health professionals and community health workers and began testing of children in Pune, Thane, Kolhapur, Dharashil. By mid-September 2025, almost 829 children has been tested and home-based assessment were launched to better understand sources of exposure. Looking ahead, we are preparing to scale up training to reach 1,500 qualified health professionals and 13,000 community health workers statewide.
On March of this year, the Ministry of Health, through the Vice Minister of Public Health, together with Pure Earth and Vital Strategies, signed a cooperation agreement. Its purpose, to strengthen epidemiological surveillance, health monitoring, and comprehensive care for children under 5 years old exposed to lead in Peru. Also, in September of this year, the official work plan was delivered. This plan includes activities in epidemiological surveillance, environmental health surveillance, and comprehensive care. This plan reflects the joint efforts of the HIESP, the HESA, and the CDC.
Este proyecto es clave porque toda esta información que se genera en esta vigilancia centinela y en las investigaciones que se van a hacer van a generar evidencias científicas que van a permitir dirigir nuevas políticas, así como cambio de normativas, lo cual va a asegurar la protección de nuestra niñez.
Entre las principales actividades a desarrollarse para el presente año está considerado el lanzamiento oficial del convenio en el marco de cooperación entre el Ministerio de Salud, Pure y Vital Strategic, así como también el estudio de manera presencial, la capacitación de manera presencial al personal de salud ambiental, de epidemiología, de atención integral, con la finalidad de reforzar a los 8 territorios priorizados en el país.
И вот в рамках этого проекта мы уже расширили это исследование на всю страну. Основным исполнителем этого исследования является Национальный институт общественного здоровья. И в рамках этого исследования мы вновь отбирали кровь, и у нас появился очень хороший кейс.
В селе Советском Кадамджайского района совместно Национальным институтом общественного здоровья и общественным объединением ЭКИС были проведены исследования содержания свинца в капиллярной крови. Были отобраны 60 детей в данной местности, и методом экспресс-тестирования, то есть в течение 3 минут, родители могли узнать результаты. И у 59 из 60 были обнаружены очень повышенные концентрации свинца в крови. При беседе с мамой мы пришли к тому, что она минимизировала факторы риска. То есть это элементарно. 3 раза в неделю она проводила влажную уборку дома. После того, как она возвращается домой после каких-то игр на улице с детьми, моет обязательно руки, дает витамины. У них разнообразное питание, то есть превалируют в основном овощи, молочные продукты, да, и это говорит о том, что соблюдая эти элементарные правила, которые на примере матери этой девочки, да, мы можем достичь очень хороший показатель и минимизировать поступление свинца в организм ребенка.
Understanding lead exposure in communities is key to driving public health action and policy change. This initiative brings together government partners, healthcare facilities, laboratories, healthcare workers, and communities. By sharing tools and resources across countries, we can scale faster and smarter. Together, these alliances can build lasting systems that tackle lead poisoning for generations.
Okay, we are going to start our tour of progress in Indonesia. And to walk us through that, we are joined by Sina Vinci, who is the program lead at Yayasan Pure Earth Indonesia. And we're also joined by Edwin Siswono, an epidemiologist with Vital Strategies. So over to both of you to tell us what's been happening in Indonesia.
Yeah, thank you, Drew. I will start this presentation. Greetings, everyone, and welcome to the thematic presentation of the third year progress of strengthening health system to reduce lead exposure in Indonesia. My name is Sina, and together with Edwin, we will present the slides for you. Our presentation theme is Powering Change Through Partnerships, Indonesia's Path to End Lead Exposure. We will tell you our story about the implementation of the program through the lens of partnership that we built along the way. Next slide. So we aim to actualize the mission of lead prevention through health system strengthening by holding blood lead surveillance, integrating the surveillance into the existing health system. So also we identify sources of lead exposure, and we also building the capacity of health professionals that we will explain this later. Next slide. Starting with the government, we have a partnership with the Ministry of Health, the National Research and Innovation Agency, or we call it BRIN, the National Laboratory, and experts. With the higher stakeholders, we build partnership through cooperation agreement, multiple coordination meetings, and joint media campaign for the program. After partnering with the national stakeholders, we also building trust with the local health agency through series of coordination meetings online and on-site. And with the implementer, we plan the implementation together with the health professional and cadre in the location through coordination meeting at least twice before the day of bloodless surveillance with the healthcare provider, namely Puskesmas. And we also build connection with cadres and the village leaders to reach our main target, which is the under 5-year-old children. Next slide. We have done our works using 3 approaches. The first is advocacy to high-level stakeholders, namely Ministry of Health and BRIN. The second is coordination with local government to get the right context for the implementation of bloodless surveillance. And last is community mobilization to reach the targeted group. Next slide, please. So first, we built partnership for advocacy. We hope to align national action with government priorities, turning Indonesia's development agenda into a roadmap for lead-free environments. And for that mission, there are 3 activities. First, we strengthen and localize existing system by building on national guidelines and frameworks, create a lasting, scalable solutions. The second is we bridge experts, institutions, and decision makers. So we consider everything we could to connect the dots, connecting science, policy, and practice to accelerate action against lead exposure. And third is maintaining high-level commitment by engaging in continuous dialogue and courtesy meeting with the Vice Minister of Health and key ministries to maintain momentum and visibility, including providing funding for a few activities related to the bloodless surveillance. Next slide. The second is partnership for multi-sectoral coordination, including empowering local health offices, namely Puskesmas, and also the village and sub-district. We also mobilizing local actors to map resources that they have and identify community needs. Translating strategy into action, we co-developing timelines and plans that ensure smooth implementation on the ground with them. And last, we are navigating systems with precision, streamlining administrative approvals and research permission to keep progress on track, including importation process for providing lab point of care testing. Next slide. The last is partnership for community mobilization. Cadres are the bridge to the communities, the heartbeat of our outreach, that the one that connect household with health program initiative. Building confidence through knowledge, weeks prior to the implementation, we are equipping cadres to identify eligible children and share clear, trusted information about lead exposure. We also inspiring community action by constantly supporting cadres to engage parents, building trust, and encourage participation in blood lead testing. Next slide. Three strategies we were using to reach the health professionals and communications are including: first is information education communication materials development or IEC materials development, capacity strengthening, and raise awareness. Next slide. IEC materials are used not only for providing education for children and parents, but also to help the health professionals to better understand the lead exposure. Before using it in the implementation, we discussed the materials with our partners, which is Ministry of Health and BRAIN, and tested it in our pre-survey location. From the pre-survey location, the feedback then will be used to improve the quality of our IEC materials. Aside from posters and flip chart, we also produce an educational video, namely PB the LED education in handfan. All credits to our amazing communication team. The presentation then will be continued by Ms. Edwin. Ms. Edwin.
Thank you, Sina. Good evening, everyone here from Indonesia. So I will let you next slide, please, Sarah. Yes, this is for the partnership for the health professional capacity strengthening. So after Sina mentioned about how we develop the IC materials, is the next step is how do we build the capacity of health professional here at the Puskesmas. So hopefully the Puskesmas as a frontline workers play a key role in implementing surveillance within the communities. And this is the first goal that we would like to share. Is the first one is to equip health professional with understanding of lead exposure risk assessment. So also with the blood lead level testings. But the second focus is also we will have adopt the national clinical guideline here by providing kind of like a counseling to parents about lead exposure risk and also the preventive actions. And the second thing is to conduct case management based on the children's risk level and blood lead level results. So we also targeted some health workers from primary healthcare here or Puskesmas, as well as a doctor, nurses, midwives, environmental officer, phlebotomists, pediatrician as well for the hospitals and the laboratories. Next slide, please. So after we do the capacity strengthening for the health professional, here also we would like to, of course, our beneficiaries, which is the parents or families here. So we also starting by sharing the result with the parents, and this process help families understand their children's current condition and the potential risk factor contributing to the lead exposure. And counseling here is goes beyond just simply informing parents about their result, but also it's to raise their awareness and empower families to take preventive action at home, because we believe that the key message that we would like to share with the parents is to kind of like how to eliminate the sources of exposure and how to bring the children with the identified elevated blood level to take further treatments. Next slide, please. Yes, and this is the just a small captures how our BLL's surveillance the flow is. So we started with the training. So we trained the cadres in 12 location here. So we equip them with some knowledge how to convince the parents to bring the children for BLL testing and also kind of like a basic information about LEDs. And after that, we also do the training for the surveillance team, which is in this case, most of them are from the Puskesmas, from primary health centers, which is doctors, nurses, midwives, or environmental officer. So we do kind of like for the blood lead level surveillance as well for the home-based assessment. This is the practice before we do the implementation. And the next picture is when we do the blood sample collection and interview. We also want to identify some potential risk factors that contributing to the blood levels, and also based on the lab samples we found in the homes. And the last thing is we also share the result with the parents, with the family, as I mentioned before. And this is we also empower health professional to do the counseling and give some practical advices. Next, please. And this is the milestone that we reached so far until this month. So we've done in the 6 provinces, Indonesia, so 12 districts, cities involved, and we already reached 1,614 children that has been tested for the blood levels, and also more than 300 household has been tested for the lead in their homes. And also this is for the child caregivers so far, and we have a 112 health professional that are trained to do the BLL testing and provide the counseling. Next, please. Of course, based on our milestone, our story is not really like a sailing smooth, right? So we see some obstacle, then we learn from that. So really important that we can also share some lesson learned from Indonesia here. So I think for the kind of like key improvement that need to be to be increased for the next is one is because we saw some kind of a leadership or technical person that has been a transition with our local government here is also with the some with the ministry. So that's why we also do kind of like maintain the communication, we can how to document every meetings and provides kind of like minutes to make sure that when we do to the new person, we have a structured handovers and a clear documentation here. And the second thing is also we face kind of like administrative and the procedural delays sometimes. That's why we also want to make a note that we should establish a proactive communication channels to anticipate, and we should minimize the some procedural delay. For example, like in Indonesia for the importation process for the POC testing devices. And also the third thing is our diverse local context and cultural nuance, because Indonesia, we have a lot of cultures and also background that is important. Although we only have kind of like one guidance, for example, like for our cadre training, but we also to localize and make it to fit with the local context here. Next, please. So yeah, what's next after we share some story from Indonesia here? So in the short term, we will have the national dissemination. So based on our findings, we will share what the findings and what the potential risk factor or protective factors that may be related to the blood level. And also the second thing we would like also to implement the adoption of the national clinical guideline, because Indonesia is one of few countries that have adopted WHO clinical guidelines. That is really important, and also opportunity for us to do the case management. And the third thing is about data integration and link health data. This mean because we want to incorporate BLL into data existing national health platform, so the government can manage the information directly and use it to make a data-driven decision in the future. So all of these are the part of our preparation. Also because we will want to do the transition for the next round, and we will have we hope that we will have a government surveillance that will design and also implement for the next round. Next, please. I think this is the last of our slide. So this is just a picture from the all location that a big thanks from the central government collaborators here as well as from the local stakeholders. And next, please. And this is the picture from our team from Indonesia. Thank you so much from Vital Strategies team and Period Indonesia team here. And terima kasih or thank you. Over to you, Drew.
Thank you both so much. We had two people curious about what we know today about lead exposure sources in Indonesia, even if the final dissemination hasn't happened. What can you tell us about what we know about exposure sources? Sina, maybe I'll start with you, and Edwin, jump in too if you'd like.
Yeah, thank you, Drew. And I will answer this first. I don't know if you would like to add later. So I think it's very secretive to answer this as we haven't held our nationally dissemination event, but I will just spoil it for you because this is just aligned with our rapid market screening study that Pure Earth have uh, published before, that the first and the primary sources of lead exposure in Indonesia is maybe the metal cookware. So we have seen this everywhere in the rapid market screening. The results are incredibly more above of our our standards, and this is more in from the ministries. So maybe that's from me. I cannot spoil it more, Drew. I'm sorry. Maybe Mas Edwin would like to add more.
I think that's enough from you, Sina. Thank you.
And then, Edwin, also a couple of people were curious about if they could use these education materials in other contexts, if they could borrow them and adapt them to other locations. Is there a place where people could find this, and do you feel they're applicable in other countries?
So I think that will be good if we can share the communication material. So maybe here our workmates will provide that maybe, and we can share, of course, Drew, because we want to share that this is not only from the best practice for Indonesia, but we want to spread the lesson for other countries or other locations.
Terrific, thank you. And I would also point our participants to the website for this project, which is reduceleadexposure.org. We are trying to populate that with materials produced under the program. Thank you both so much. And with that, we're going to fly over to Kyrgyzstan and our colleague Indira Zakapova, who's the director of ECOWIS Bishkek in Kyrgyzstan, to lead us through progress there. Indira, over to you.
Thank you, colleagues. Good evening to my colleagues, partners, and my friends. Let me share my screen. Yeah, I hope it's seen to all of you.
Yes.
Yeah. Okay. Just on this first slide, you can see just to have some impression about where located my country. It's a landlocked country. You see it's deep in the Central Asia. We have border with Kazakhstan, China, Tajikistan, Uzbekistan, and Kyrgyzstan is mountain country which laying in the Pamir and Tian Valley ranges. Before to start present the results for the last 3 years of our project, I would like to say that, sorry, just not, yeah. I just would like to say that it is absolutely impossible to go to the sites and work with the population in communities regarding the blood, etc., without permission or without some legitimation of our activities and working with the Minister of Health. That is why the first task for us was, first of all, to construct and establish this partnership with Ministry of Health. And in the beginning of 2023, we signed the MOU, and then on the basis of this MOU was established the interministerial working group. The member of this working group, Minister of Emergency, because they operating legacy sites such as lead tailings, uranium tailings, which are next to the settlements where we worked. And the project coordinator for our project was appointed Deputy Minister, Ms. Bibizhan Arpaeva. And first of all, we started from assessment of capacity of the national labs, and as a result, we found out that we don't have any laboratory in the country which can do analysis of biological materials. Yes, we have laboratory which can do different environmental analysis, soil, drinking water, paint, toys, etc., food, etc., but no any for the biological materials. So then 2024, we started from purchasing necessary equipment for the launching BLL and home-based assessment process, and we imported 6 lead care equipment and 1 XRF, and we sorry, yeah, and yeah. Till October, it takes really time, and it was not easy process, but finally in October last year, we received all this equipment and started with the training. First of all, teams for BLL and home-based assessment. We took some environmental samples, and of course, all this process was accompanying with a wide informational campaign. In the beginning of this year, we finalized BLL and home-based assessment, and only last month, till the end of September, we finished with the analysis of data received from this research, and from the March till the October, we were in the process of ICPM purchasing process, and half year with international experts, we discussed the technical specifications for this equipment, and finally we defined last month, and now we have provider, we contracted them, and even did the first wire for the provider, and hope in according to the contract 180 days is half year we will have such equipment in Kyrgyzstan. It's a big important issue for us. And during this week, last week, and we conducted several events dedicated to this lead week. We conducted some press conferences, roundtable in Ministry of Health, and webinar for the staff of Republican Center Health Promotion. Almost 84 person participated in this webinar. A bit factual date, it's 1,140 children were tested, 188 households was assessed, 44 blood test was done, 114 soil and drinking water samples was done, and On this slide, you can see our teams, which we trained. We had 6 BLL team because we received 6 lead care equipment, and this team worked parallel at the same time in different provinces of the country. And we had only one team on XRF on home-based assessment because we have only one XRF. Here you can see where we worked around the country. We worked in 21 settlements, 18 of them with no known source of lead exposure, and 3 of them it's legacy have legacy sites. It's from mining which left after Soviet time and closed, but still have lead tailings, uranium tailings, etc. And you can see that, yes, the work was done around all the country. Kyrgyzstan is not so big country. We have only 6 million population. On these graphics, you can see that in the beginning, we supposed that maybe in some far from the industrial areas, rural mountain villages, they can be clean. But the study shows that lead poisoning is around all the country and requires national monitoring and prevention program. Regarding the factor of risks, the main source of contamination in Kyrgyzstan is paint, and but we didn't do home-based assessment in that 3 legal mining sites. But the high concentration of lead we found in some metal cookware, some samples of soil, and several toys. But the main key source of exposure is pain. In parallel with BLL and home-based assessment, we did a wide public awareness campaign, and we did it with the Health Promotion Committee and the National Public Health Institute. It's again some structural agencies under the Ministry of Health. We trained 45 specialists of this center who worked and prepared the ground on the places where BLL team worked and the home-based assessment team worked, and they were tasked to persuade and bring mothers with the children to testing. And their role in this process was very, very important and big. We work with community in all 21 settlements. We organized round tables, seminars. We met with the local administration, medical facility management, the school principals, with the healthcare worker, teachers, care providers, and we get to the population through the different social nets like Instagram, Telegram, Facebook. We have our own YouTube channel, and in total we get more than 130,000 people through all our work. And we did some media appearance through TV, radio, etc. We organized some educational events in primary school, and with organized a quiz night. It was a really interesting experience for us. This quiz night with students from the medical university and the college. Informational materials which we developed we widely used, but I have to admit that one of the big problem which we faced that there were no materials regarding the lead, about the harmful of lead to the health in Kyrgyz language. Yes, we have a lot of in English, in Russian, but no in Kyrgyz. And one of the main tasks for the project was to translate and produce, develop these materials in Kyrgyz language, which we posted and on our all sources and distributed. Of course, we faced with many difficulties, like from us, it was a big experience. It's a custom clearance procedures for the equipment. We didn't have no laboratory for determining lead in biological materials. We still don't have clinical protocol for the children. We don't know how to treat them. And we faced with the refusal by some parents to participate in our testing. And now we of course, we were able to overcome all these difficulties because we had our good, strong partner. It's in the face of Minister of Health, and we had really big support from their side. The nearest our tasks, it's finalize the procurement process with ICP-MS for laboratory of for the National Institute of Public Health, and installation training of the specialist, accreditation. I suppose that till the end of this year we will have a clinical protocol, because now the working group established by Minister of Health working on it, and it will be developed till the end. Then we, on the basis of clinical protocol, we will adapt, implement training models, and then we will go and start with the training sessions for the health care workers. And next, our big task is establish a consultation office or informational hub. Mostly it will be on the basis of National Republican Children Hospital. Of course, we should continue to work with the parents of the children with elevated lead levels. And of course, we will continue with the informational campaign, because the first stage showed that the level of information, the awareness raising of the public in Kyrgyzstan was really really low. I just would like to express my my gratitude to experts from the Vital Strategy, especially to Ilu, who from the beginning, from the starting to develop a study protocol for the whole BLL process, was with us and guide our national experts till the end, while all data was analyzed. And we have now all this data, and we presented it to the Ministry of Health last week on the round table and discussed these all results. And we hope that we are on the age when we will have finally some kind of national monitoring system regarding the lead. Thank you for your attention.
Thank you so much, Indira. In the interest of time, I'm going to keep us moving to Peru, but Indira, there are many questions for you in the Q&A box. If you could pop in there and try to answer some of those questions in writing, that would be great. So now we're going to move over to Peru. We're joined by Rodrigo Velarde, our country director for Pure Earth in Peru. And Rodrigo, over to you.
Hello. Hello, Drew. Thank you for the introduction. Thanks, Sarah, for helping with slides. And I'm here to share the results of this third year of the project. Please go ahead. So last year, we celebrate the Memorandum of Understanding with the CDC. And this year, I'm really happy to share with everyone that we finally signed the agreement with the Ministry of Health. We have been lucky enough for the participation of Drew in this event. The one over the picture is the Vice Minister of Public Health. And with that, we have strengthened our relationship with MINSA, which is the Ministry of Health. The next one, please. With that agreement, we actually decide and select which are the key partners from the ministry that will participate in this project. our focal point on our first and our main office participant is the CDC, who has the responsibilities of coordination of activities and the epidemiological surveillance. Then we have the Office of Environmental Health and Food Safety, which is called DIGESA, and with them we will work the environmental surveillance and the household assessments. Then we also have the Office of Strategic Interventions in Public Health, DGESP, who they will be in charge of regulating the care for intoxicated patients. And now we have another three actors based on the work plan, which is the direction or the regional direction of health, the district health facility, and the health facility per se that we're going to be working with. With them, we will be doing the evaluation on the primary care level, the counseling, and the medical care for the intoxicated patients and sampling. The next one, please. So I would like to share with you our shared journey with MINSA. We start with the signing of an MOU, and then we start when we're still coordinating meetings and also technical meetings. We signed the MOU, and then we have a first webinar. Then we sign the agreement, and with that, we start working on the working plan, which is how we're gonna operate in each of the sites. So can we go to the next one, please? The CDC within the Ministry of Health has selected 8 sites to work. 1 in the North Zone, which is Tumbes, 4 in the Center Zone, Pasco, Lima, Lima North, and Callao, 1 in the Amazon Zone, which is located in Madre de Dios, and 2 zones in the South, which is Moquegua and Tacna. Next one, please. I would like to highlight that Peru has already a healthcare flow to treat intoxicated patients and also to evaluate the exposure. So these are the 4 phases: the risk factor surveillance, the implementation, the lab test, and the medical evaluation of the kits. This is already been established by the Ministry of Health. So our role will be supporting each of that phases. For example, we will provide training for environmental assessment and epidemiological surveillance. We will provide equipment for the phase of implementation when we are donating 8 lead cares. The lab test will be covered by us. This lab test is the confirmatory blood sample that is submitted to Sensopas, which is the confirmation with the readings of the lead care. And also for the medical evaluation, we will be providing training with workshops. Everything will be also covered with logistical and all the administrative process required. And also we will be helping in the data processing. The next one, please. So we have already donated 8 lead cares, and we have handled them to the CDC, and they will be distributed, which the work plan that I mentioned before, it has to be prepared for each of the sites. So there will be trainings for each of the 8 sites that I already mentioned. Also, we are planning to give 1 XRF to DIGESA, which is the Office of Environmental Health. And by the end of this phase, we will be evaluating 2,500 children in the sites that I mentioned. The next one, please. So last week, I'm really happy to share with all of you that we have the official project launch. And this was coordinated with the offices that I mentioned prior in my presentation. And we have been lucky enough to receive 3 representatives of each site: the representative for patient care, the representative for environmental health, and the representative for epidemiology. And they have participated in a 2-day workshop, which covers all the themes related to how to implement the strategies for the project. The next one, please. So what are our next steps for next year, which is going to be crucial for this project? First is keep the coordination going. And we have 3 different levels: at the central government, at the regional level, and also in a site level. Then we should get all the supplies required for the implementation, which are the environmental assessment, the epidemiological surveillance, and the primary care. We will start coordinating the workshops related to environmental assessment, surveillance assessment, primary care, and how to take the samples. And we will be coordinating with each site about their work plans, how they're going to be the implementation, which is we are expecting to implement the project in the first semester of next year. And also we will have a supervision program coordinating with CDC, Pure Earth, and Vital Strategies. Next one, please. We're really happy to get the CDC in a full coordination, and they are really interested in, and they're really happy to be part of this project. This is an interesting quote from Dr. Cesar Munaico, which is the director of the CDC, and he mentioned how the scientific evidence will guide new policies and regulation to protect the health of our children. And the next one is Licenciada Laura Naiwa. Sorry, can you go back? Which is our focal point, and she is a force of nature, and she is one of our key stakeholders in this project. And she's really thrilled that we're strengthening the technical capacities and building a healthier future for all. So I want to thank, even though I'm the one who's speaking, I'm speaking on behalf also of Carlos Cabrel and Maria Elena Arias from Vital Strategies, which is the team implementing the project here in Peru. Thank you, Drew. Back to you.
Thank you, Rodrigo. And there are a couple of questions that speak to a similar theme. And Indira, I'm interested in your thoughts here too. The questions are, what is the government's attitude toward next steps after this? Are you seeing high levels of engagement? And do you think that there's the opportunity to continue making progress after this program, to continue using the methodologies, continue using the training and equipment that were provided? What do you see for the future?
Yes, I see that very big interest from the Ministry of Health side, and I think I can say that ministry considers that it's their own project, and they really expecting this new equipment. ICP-MS is modern, the very highly technical with a high potential equipment, and they intend to do the next monitoring stage and do all tests with the help of this new equipment. And this will give them opportunity to raise capacity of their staff and laboratory. And it's first, I can say that it's first so big survey and big first step in the Kyrgyzstan, where we started to work on the subject of lead. And the ministry just started to obtain this new experience for them. Like many years ago, it was tuberculosis, some other disease, but now it's all diseases and the poisoning with lead. And they clearly understand that it's really a big problem, and they intend to continue to work on this. Now they have some data for the evidence that it's really problem. All our data will be used for them. Continue to discuss it in the government with Minister of Economy, with Minister of the Finance, in the government. You understand me? Yeah, it's only first step. I couldn't say that at the moment that yes, it will be like this or they will do this, but they started to work on it, and they really shows a very strong interest in continuing this work.
Excellent. And Rodrigo, what do you think of the future prospects in Peru?
Yes, I think the future is really looking promising. And I want to highlight that, first of all, we built the trust with the government. So I think that's why we got delay if we compare with other countries. but we start working with the government since the beginning. So now in year 3, I can say that they trust Pure Earth, they trust Vital Strategies, and they trust in the project. So we are strengthening the existing surveillance activities and existing flowchart. So they will be more than happy to keep working with us to improve the existing one and potentiating the results.
Excellent. Thank you both. So now we are going to move over to Colombia. We're joined by colleagues Claudia Gonzalez, Acting Country Director for Pure Earth Colombia, and Jessica Rodriguez, Environmental Health Consultant with Vital Strategies Colombia. Over to you both.
Thanks, Drew. Good day, everyone. Yes, we are here. So we're pleased to share Colombia's experience in reduced lead exposure. In our country, this initiative has focused on connecting science, institutions, and communities, building the foundation for a sustainable national response through evidence, dialogue, and collaboration. Over the past years, we have learned that progress in public health depends on collaboration and institutional dialogue. In Colombia, we have been building bridges between the health, environmental, and academic sectors to create a shared understanding of how lead surveillance can be integrated into existing systems. These dialogues have helped clarify institutional roles, identify capacity gaps, and build trust, essential elements for advancing a coordinated and sustainable response. Colombia's progress is grounded in both international commitments and national legislation. At the international level, Colombia adheres to the Basel and Rotterdam Convention, and as a member of the OECD, it has joined the global commitment to reduce lead risk. Nationally, the foundation was set with Decree 948 of 1995, which phased out leaded gasoline, followed by Resolution 372 of 2009 on battery recycling. On 2020, Law 2041, the Lead-Free Environment Law, formally established the right for a lead-free environment and mandated the creation of a national blood lead surveillance system. Subsequent regulations have set limits for lead in ceramics and lead in toys, while a technical regulation for lead in paint remains pending approval. This evolving framework, supported by coordination through CONASA and SUISA, Colombia's intersectoral health environment systems, which provides a foundation to move from policy to implementation, a critical step toward national surveillance. Through this project, Pure Earth, in collaboration with Vital Strategies, has focused on bridging science and systems, turning evidence into practical tools that strengthen institutions and prepare the health system for implementation. Our joint efforts have helped position lead surveillance as a national health priority, ensuring that future monitoring is not only technically sound, but also guided by public leadership and institutional ownership. Looking forward, Colombia's path combines regulatory progress, institutional capacity, and community engagement. The strategic roadmap includes 5 main directions: advancing toward a technical regulation on lead in paints, creating a blood lead surveillance core to build the first national baseline, strengthening the laboratory network, promoting lead-safe procurement in schools and health facilities, and expanding education and communication efforts with key partners. These actions define a realistic long-term vision for a national system, one that is evidence-based, intersectoral, and sustainable. And now, to explain how this vision is being technically prepared, I'll hand it over to my colleague, Jessica Rodriguez from Vital Strategies.
Hi, everyone. Thank you for joining us today. Yes, so as my colleague said, we are building our own road towards a lead-free environment in Colombia. And by doing so, we are having a different approach in how to conquer this objective. We are doing a very heavy technical preparation in this roadmap building. Next, please, which includes, in the first place, we understand that the country, even though we have a law and we have regulations, we are still lacking the understanding of the level of the public health problem that lead exposure means for the country. To answer and to build towards what is an answer to this problem, we have creating a bottom-to-top approach by empowering local communities and local health departments towards the understanding of lead exposure in their sites by doing measurements of lead in blood. And with this information, we will serve as evidence for not only for the local governments, but also for the nation to understand what is the level of lead exposure in children in our country. To do that, we are thinking on a piloting of a epidemiologic surveillance active system towards which implies household survey, meaning that we will be going to different households that are going to be selected randomly in the country and understanding what is the level of lead in the blood of children, but at the same time understanding what are the potential items to which children are being exposed, so that we can have a integrated answer to the question, what is the level of the problem and what are the potential sources of exposure that we can work on to reduce lead exposure. But we are also working on using, or more than using, understanding what data system and a surveillance system exists in the country at the local, at the national level, so that the data and information that we are collecting can be integrated to serve as evidence for policy making and decision making in the country regarding lead exposures. And all of this will be used towards the building of training materials, not only for health workers, but also for environmental workers, so that they can work um, collectively in creating policies and preventing measurements for the country and the communities that they serve towards the prevention and reduction of lead exposure. And all of this, we are doing it by having an institutional coordination where we are not only inviting to the table representatives from the government, but also from civil society institutions, and also inviting communities to build on all of the systems and all of the mechanisms that we are proposing and piloting in the country to serve as surveillance and prevention on lead exposures. Next, please. And by what is our main approach to this? Is strengthening local cooperation, meaning that we are empowering local communities and local health departments and local government on how lead exposure is understood and how they can work towards reducing lead exposure in their communities at the local level, but creating evidence for the national government and for the national flora, so that we can collectively build a approach to reducing lead exposure, not only at the local, but also at the national level. Thank you. Now, I would like to go to questions and answers. Back to you, Drew.
Thank you both so much. I want to make sure we have time to get an update on Maharashtra, India. So I'm going to hold the live Q&A, but you have questions in the Q&A box. If you could both jump in there to try to answer. So we're going to zoom over to India now. We're joined by Shailesh Patil, Program Director for Pure Earth Led India Private Limited, and Jitendra Chavan, State Program Manager for Maharashtra at Vital Strategies. Over to you both.
Thank you, Drew. We are talking about Maharashtra. It's one of the state in India. So, I'm just giving you a brief of what is Maharashtra, about Maharashtra. Maharashtra is one of the most industrialized state in India. So it's contributed around like 15% in industrial output in GDP, which is the second most populous state, like heavily urban density. Like there are metro cities located in Maharashtra. There's big industries in many belts. It also tribal region belt. And it is divided into 8 administrative circles, and we are implementing the project in each circle or each division. So, why Maharashtra? So, at an estimated 292 million lead poisoned children live in Colombia, Indonesia, Kyrgyzstan, Maharashtra, and Peru. So, in India, we are only doing this Takeda project only in Maharashtra. So I'm requesting Dr. Jitendra to take it from here.
Yeah, thank you, Dr. Shailesh. So the project activities that we are implementing in Maharashtra is to access the health system's capacity, to assess the health system's capacity to prevent lead poison exposure, to strengthen their testing capacity, and based on the gaps that we identified during capacity assessment, we are supporting government of Maharashtra to design and implement statewide representative surveillance system, which will not only be a scalable model in other states, but it will also strengthen the existing healthcare system of Maharashtra. Next slide, please. Next slide, please. Yeah. So during our gap assessment, we identified that stakeholder coordination is the key to achieve the success. So the key stakeholder in implementing this lead surveillance is Maharashtra Pollution Control Board, which can take lead, and with support of other departments like Public Health Department and all these departments can support Maharashtra Pollution Control Board. We also identified the state working committee under leadership of Director of Health Services Maharashtra, which is going to support us to implement this lead surveillance project in Maharashtra. In public health surveillance, we identified that in order to implement this project, the target population is children from 0 to 5 years. So RBSK and Rashtriya Bal Swasthya Karyakram, which is a key program of government of Maharashtra, which is a key stakeholder in Maharashtra. Apart from that, for pregnant women, we have identified that during ANC, this screening can happen, so that all pregnant women can be assessed for their blood lead levels. And for others, the National Program for Non-Communicable Diseases can be a key project to program to implement lead poisoning surveillance. Apart from that, laboratory surveillance, strengthening of laboratory capacity is equally important. So we identified during our assessment that though there are laboratories into Maharashtra, but their capacity has to be improved. So laboratory capacity improvement is one of the gap that we identified. And then in capacity building of healthcare staff, we have already started this activity. We have conducted state level orientation. We involved all the district counterparts, government officials. We conducted the state level training, as well as we have completed district level trainings in 5 districts out of 8 selected districts. So these are the key findings from our capacity assessment. Next slide, please. So there are a state working group is formed, and we have identified the key stakeholders from each department, from Director of Health Services and from other institutes. So for each area, there is a key stakeholder, and all these key stakeholders have been mapped so that for every domain, we have a key stakeholder whom we can sensitize and implement the project. Next slide, please. So for this state level surveillance from the whole Maharashtra, as Dr. Shailesh mentioned, that there are 8 administrative divisions in Maharashtra. From each administrative division, we have selected one district, and similarly, we have also taken care that rural as well as urban representation will be there in this surveillance. So 6 city corporations and 8 districts have been selected. The target population for this surveillance project is from 1 year to 6 years. Total sample size is 1400 children. And the sample that we will collect for this surveillance is capillary blood surveillance, capillary blood. And to get the confirmation test, we will have the venous blood collection, which will be 10% of the total capillary blood samples. Blood testing and analysis will be done by portable analyzer, and blood data collection will be done through mobile screening camps. Yeah. Next slide, please. So in this project, the key activities are our team goes in the field. They do the household visits, and screening for eligibility and recruitment is done in the field. Based on the eligibility, the consent forms have been are filled up, and the capillary blood sample is collected. It is tested by the portable device, and the results have been shared based on the recommendations as per the guidelines. So these are the key activities that our surveillance system does. Next slide, please. So these are some of the photographs from our BLL testing demonstration, where our senior management team from Vital Strategies have visited Maharashtra, and they have demonstrated the government officials the way that lead testing can be done in the field. And they have convinced the government officials that this is a scalable model, and it can be done in the outreach setting. Next slide, please. So as I mentioned, that capacity building is the key to make this project successful. So in Maharashtra, we have already completed a state level TOT, where all the representatives from government have been trained at the state level. Apart from that, 5 districts we have completed training with 100% attendance, which itself is a big achievement because we had 100% attendance from all the expected participants in Maharashtra. So in that way, we have completed the capacity building of healthcare staff. So now I will request Dr. Shailesh to take it forward with home-based assessment. Yeah, thank you.
And
Thank you, Dr. Jitendra.
Note that we're very close to being at the end here, so as quickly as you can, please.
Yes, please. Yeah, thank you. So basically, like Jitendra told us about the training part or BLL training part. So BLL, we also have home-based assessment to know the source exposure. So AIMS Nagpur, like All India Institute of Medical Sciences, Nagpur, the institution is our HP implementer. And so we had home-based assessment training at AIMS Nagpur. So where our key stakeholders were present, like public health department officials was there, UNICEF representatives was there, Pehla India Foundation was there, Department of Preventive and Social Medicine was there. So participants were like the field activity team, research assistant, senior research fellows. Those are resident of doctor of medicine, PSN department. There are public health consultant and qualified healthcare professionals, as well as community health workers are also involved in the participant. The outcome was we able to train them in hands-on training to know how to use XRF, the source, the knowledge, the technical aspects of source exposure, how to use XRF, to understand so understanding of lead exposed assessments. So there were like two types of training. First was classroom session. In that in-depth knowledge was given. Our technical director Alfonso flew away from all the way to US to Maharashtra. He gave all detailed training, theoretical aspect, practical aspect, and how to use XRF, how to take precautions. We tested few items at the classroom level, and the best part was like to implement the knowledge in the field visit. So we went to nearby corporation area. So we had 2 to 3 households where our field team actually tested how to use XRF, like 90-degree. There, how many modes are there? Like test mode, paint mode, test all mode, soil mode. So how to use the modes? What are the key? How many readings should be taken? All minute course corrections are made during our field visit training. So, like Jitendra mentioned, like we are focusing on institutional strengthening, capacity building, to aim that our systems, our structures, our capacities within the government framework, so we can sustain lead poisoning prevention program beyond the project. So we are focusing on sustainability and to establish a foundation for long-term lead surveillance, response, and prevention in the state. We are focusing on capacity building on these two aspects. And these are few snapshots of DLL training, HB training of qualified healthcare professionals and community healthcare workers. Like Jitendra mentioned, there was an extremely positive response. There was 100% attendance. People are very excited to learn about the new thing. In India, still it is a very neglected or niche area. People are eager to learn about understanding lead poisoning prevention strategies. So I will have just feedback of medical officer.
Hi, myself Dr. Amit Jadhav from Thane Civil Hospital. So we are proud to see this program running by Pure Earth regarding the lead-related hazards, those that we can see in today's world. And this is prioritizing the children from 0 to 6 years old, for which they are running some analytical projects. So we're proud that being a part of this project, and we love to give a support from whatever needed from our side to them, as in a government or as in a individual entity. So best luck for them. Hi, myself.
So it shows that people like medical officer, healthcare professionals are very excited. They have complete support. So how we use the public education and community engagement efforts. So we focused on like some key event activity during important events such as World Environment Day, International Lead Prevention Week. So we have our reduced childhood exposure .org website. We publish blog articles routinely basis, how we conducted trainings, how we series of articles published by nodal officers, and we have Maharashtra has government their own monthly magazine from last 20 years. So we publish a series of articles talk about lead prevention, our project, stakeholders, training material, with dissemination of collaterals through Facebook, Instagram, and other social media handles of government handles, social media handles, so that it spreads across to doctors, to community health workers, to all the stakeholders in the state, as well as in the country also. So till now, we have almost 52% completed home-based assessment in Pune district, almost 100%, Thane district 100%. So we are like halfway stage to do home-based assessment. We are aiming that in next couple of months we will complete the home-based assessment in Maharashtra, and we are looking forward. Thank you.
Thank you both so much. It's heartening to see these updates. We're out of time, so we're not going to do more Q&A, but I think we've gotten to most of the questions in the Q&A box through written answers. So if you asked a question, please check the Q&A box to see if an answer was provided in writing. And I want to thank everyone for joining us today, including our panelists for such encouraging updates and insightful discussions. A recording of this webinar will be available soon on pureearth.org and also on the project's website, which is reduceleadexposure.org. And at that website, you can also find a lot of the materials that were discussed today. A lot of people had questions about where to find materials. So please go to reduceleadexposure.org. To stay up to date on this work and other efforts to fight lead exposure, please follow Pure Earth and Vital Strategies on social media. Pure Earth is at Pure Earth Now, and Vital Strategies is at Vital Strat. And if you have any follow-up questions, you can always reach us at info@pureearth.org. Thank you again, everyone, for being a part of this conversation, and have a great rest of your day. Take care.